So Mario, you're here today after we did treatment on your spur in the back of the heel in your Achilles tendon. So you actually came to me referred by my website, right?
Right.
So you looked up that I do the Shockwave Therapy and you had somebody up north, one of your relatives, who had it done, right?
Right.
So you came to me very determined because you said, I know what I need and I need the Shockwave. I'm like, okay. And we did 3 treatments, 1 week apart. And you're here today, a couple of weeks after the last treatment I did. So how much better you are in terms of pain?
So it's almost all gone. Like I said, just when I walk sometime, distance, it'll be a little burning pain, but that's it really.
But nothing like sharp like you had before?
No, it wasn't constant.
So for people who are contemplating that open surgery, remember how I offered you open surgery and you said, no, I want to do what my cousin did. Because remember how it takes a while to get better and they have to be completely off their foot for 4 weeks, and then it takes probably about 6-7 months for them to completely feel better.
Right.
Would you recommend this as an alternative?
Oh yeah, definitely. Because like I say, my friend cut his Achilles tendon.
Right, I do that all the time.
Yeah, but I mean, he cut it by a door whack.
Oh, okay.
I remember having long problems he had.
Right. Well, it's the same surgery for this. Is we cut off the tendon, we shave the spur, and then we put it back with 2 bone anchors.
Right.
So that versus Shockwave, which is not even invasive. And was it painful when I did it?
Well, the first time it felt like something.
Right.
It was pretty bad. After that, it was all right.
Like it was worth it, right?
Oh yeah, it's better than getting operated on, sure.
Yeah. So, all right. Well.
I mean, how come Medicare paid for it before? Now they took it away.
Long story.
No.
It was actually not Medicare. It was a different insurance company that hired somebody in Australia to do a study to show that it's a 50-50. And I think that they only had less than 30 patients, which is really not a true scientific
my
study.
friend had it done. After I couldn't get it done because of Medicare would pay for it 10, 12 years ago. But it just went away. But you said it broke off. That's why it got worse.
But it's unfortunate. You know how insurances are. They do unreasonable things sometimes, and it's not covered right now.
No.
Hopefully one day, as I told you, there is a study that is going on out of Chicago, and hopefully one day it will be covered.
Right.
So we're hoping,
well,
because look.
Preventive medicine rather than get operated on.
I know.
You can't have to worry about getting an infection, no blood clots.
Listen, you're preaching to a choir, okay? Because I agree with you. I think that it's an excellent procedure, and I've done it probably for close to 10 years now. And it's an excellent procedure and it works. It's just the problem is the insurance companies and getting them to pay, because I'm sure open surgery is probably about 5-6 times more expensive. At least, right? Plus general anesthesia.
How about the place you operated in too?
Of course, that's the most expensive. Right. All right, dear.